For those of you that may have Googled Kronos, we're a IT healthcare solutions for workforce, so we're able to help you with products. Now at that point most of you may well switch off as nurses and healthcare professionals. Firstly, I need to tell you my 4 key objectives for this short time that I have up here. Number 1, and Clive will support me here, my colleague who came before me, I'm not going to trip and fall down this hole that is down here that every single one of us has struggled with, so I'm not going to do that. I'm going to make great friends with Mike here because I certainly hate him, and I am trying my best to reduce my Brummie accent and the impact of that, so I apologise for that. My 4th objective is actually one for you, and that's to introduce to you how IT solutions, regardless of where they come from, but how they can help you to try and demonstrate your 6 C's and achieving that in your organisations. So firstly, trust me because I am a nurse. Even though I'm working in this arena, it's very new to me. I've been there for 3 months and I'm liking it. My background is 20 years in the NHS. And did do a small amount of private healthcare work before that. My most previous role in the NHS was as a lead nurse implementing software solutions to help them demonstrate competencies, achievements in compassion and actually workforce responsibilities that they had. Flick past that one, but there we go. There's the slide with the 6 C's for you to see. So we have a daily staffing challenge in healthcare, and that's not different in any organisation, but what we have is managers that are creating schedules, and that's usually in accordance with what you've been told you can spend, so your budgeted staffing. And from that we then have to react to what becomes our daily reality. And so we have things like people ringing in sick, discharges, transfers, late calls, admissions, and then to add into that mix we also have patient or service acuity and the demand for what we're actually trying to provide. So that adds another complexity into what we're trying to struggle with on a daily basis. There begging the question, which links to my title slide, what is our patient demand and how are we actually meeting the resources to that demand? So how are we matching that up? So every one of us who's working in healthcare knows that on a daily basis we've got this juggling act that we're going through. So looking at information technology with the 6 C's, how can technology really help us? Is there ways that we can actually say technology is helping me to demonstrate compassion at all in an organisation? And we know that these are difficult things to demonstrate with certainty. And these 6 C's are organisation-wide, so how can we demonstrate these things organisation-wide and not necessarily just at my local level, either within my team or within my nursing region? So what is in our toolkit? So I'll go through each of the 6 C's one by one and we'll just go through how we can help. So we can help with practical care activities. There's the key functions of task-orientated care. So, you know, I'm with you on delivering tasks. It's very simple to define that you've achieved that or not in terms of demonstrating your ability to deliver care. We can record care events in software solutions. It's easy then to interrogate that and to actually look back on trends and abilities. Who was assigned to patients? How have they responded to their care needs in that particular instance? And we can demonstrate accountability. There are solutions that can help you in identifying which nurse looked after which patient at which time. Were they competent to do so? Had they been trained to do so? Who decided that they should do so? And so we can use this real data then to inform the practice. And again, just in the toolkit box down on the right hand side, we just got some examples there of how we can demonstrate these things. In terms of compassion, we can show that people have knowledgeable care. There is a way, as with many solutions or recording activities, even an Excel spreadsheet, you can record someone's activities and training that they've been to and demonstrate whether they actually have knowledge and skills in that arena. We can demonstrate that we're showing compassion as an employer, I want to be an employer of choice. I'm considering how I'm distributing the workload to my staffing. I'm considering the demand that is put upon them in their service and how that interprets to the quality outcomes that they then deliver. So I've broken this down into compassion for patients and compassion for staff, because often when we're looking at 6Cs, we're thinking about the outcome for the patients, but the outcome for the staff are as important to us as organisations. So in terms of for patients, we're looking at continuity planning, being compassionate about how we're thinking about planning for their future when they're in our care, measuring dependency, acuity, and again, demand and throughput, etc. And also future-proofing, so considering what's on the horizon for our groups of patients and how we're going to tailor our service to meet that. In terms of compassion for staff, we have things such as roster planning, just simply being able to be fair and equitable in the way that we're scheduling our staff, being clear about the way that we're doing that and giving them opportunities to be part of that process, rather than scrambling around looking for the off-duty request book and someone else has it or it's already been taken away. So there is an element of fairness. Again, this leads back to being an employer of choice for some people when there are jobs available. And again, I mentioned the patient nurse workload planning tool. One of the most recent things that we have is an ability to link acuity of your department and distribute the workload fairly across the people who are on duty, so that you're not applying too much pressure to one nurse and very little pressure to another. Again, considering their skills, attributes and all of the knowledge base that they have and what they bring to the game. In terms of competence, we're able to record skills and competence. We're able to centrally hold that data. As there are many solutions, and again, just going back to even using an Excel spreadsheet, if you were collating this information, you can then use it, and you can use it reliably. Demonstrating assurance of professional registration, that's key. We want to know that the people we have on duty, whether they are medics or nurses, or definitely need to describe and indicate a competence in a particular skill, that whatever it is, that we can record that, show it and collate that and demonstrate it if we are visited and asked to do so. Again, competence leads into looking at things like incidents and complaints and being able to demonstrate what was really going on this day, who was here, did it matter, what impact did they have. And so there are solutions available where you can root cause analyse, and without having to screen lots and lots of different notes and papers and duties and tables, it can all centrally be in one place. In terms of communication, we have an ability to provide visibility and an access to reports, and again, real-time statistics. So there's nothing better than being able to, if someone knocks your door, comes to your front desk, be able to say, okay, no, I actually do know my patient to bed ratio right now. I can demonstrate that for you. Thank you for asking. And if you'd like me to collate that into a report and send that on to you, I can do that too. How far back would you like me to look? It's good to be able to have that there. And this is about that openness and communication that using solutions can offer to you. At an executive level, at looking at demand and workforce data and being able to trend analyse. So not only are we looking at the history, we're able to inform the future. We're able to budget set a little more productively and efficiently and actually know what we've going on. Again, with the department and divisional levels, we're looking at the ratios. We know that's a hot topic for us as healthcare providers. Being able to show what the true ratio is at any given time is a very valuable thing to be able to demonstrate. And again, looking at pressure and events at divisional and lead nurse level, any type of governance statistic and demonstration of what's really going on is very powerful when making a workforce argument. And at staff level, again, their ability to be able to see their work plan, to plan their own work-life balance, to see that in 6 weeks' time 4 weeks' time, whatever your local arrangements are, to see where they're demanded to be at work, at home, being able to help them to balance that work and life together and see their training needs. Along with other items, we can look at when their skills are going to expire. We know we get our PIN registration reminders to the nth degree, but again, a little alarm bell when you log into your portal doesn't hurt as another added reminder for you. And over there in the toolkit, you can see that we've got the ability to alert and escalate. So when something's happened, why not be able to receive that on your iPhone or your iPad to say, okay, there's a problem down at Ward 10 and you need to go and sort that out. That's where your focus needs to be right now. In terms of courage, often a difficult one to demonstrate, but to have confidence in technology in a healthcare environment, that's courageous. Being able to say that I'm brave enough actually to use software to help me demonstrate what's really going on in my departments, and the courage to say, and these really are the statistics, and I'll show them you right now. That's a courageous place to be. Having the clarity and also the potential exposure, because if you're one of a few organisations using software in such a way, you are raising your head above the parapet, you are going to be under scrutiny, but equally may be praised for being so brave to do so. And this demonstrates organisational openness and a willingness to change and actually manage that change within your organisation. We're never going to escape from technology. It's here to stay, and that's the way that healthcare is going. We need to come along on that journey. In terms of commitment, thinking of using solutions, we have a commitment to investing, so demonstrating as an employer or as an organisation that this is important for me. I can see what's going on, and this is where I want to put some of my money because it needs to be there, as well as then being able to use that to invest in the right areas for your organisation. And a commitment to a change management strategy and contractual relationships, so there's a co-opting, working together with other organisations and suppliers to demonstrate what you need to with regards to the 6 Cs. That's my pre-nearly at the end slide, so that's my cue to say you didn't fall over, Gaynor, you did a damn fine job there. I'm not sure the Brummie accent was so controlled, but my next slide is just an unashamed show of the sort of products that Kronos can help supply you with. But my key objective as a nurse is still my title. I'm proud to be a nurse and just wanted to be able to come and speak to you about how IT solutions can actually work within the nursing arena. Thank you.